Hello, I'm Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about general post-operative instructions for a laparoscopy. So a laparoscopy is a surgery where we make little small incisions, usually about 8 millimeters, and we put a fiber optic scope, look inside your abdomen. And generally an OBGYN physician will do this for tying your tubes or removing your tubes for sterilization, looking for endometriosis, looking for chronic pelvic pain, looking for pelvic adhesions, maybe an ovarian cyst, removing an ovary, things like that. They're outpatient surgeries, and they're usually have a pretty easy and quick recovery. So generally speaking, when I do those surgeries, there are usually 2 or 3 incisions, usually one above the belly button, the umbilicus, one on the left, one lower, or either or both sides. So you'll probably have 2 or 3 incisions. Each of those is closed with a suture that is dissolvable. Some doctors use a non-dissolvable or a stitch that is visible, and they'll have you come back later for removal. Generally, I don't have that suture, so it dissolves by themselves. You might have little steri strips on there. Those are a little like tape that hold your incision and make it a little prettier, and a Band-Aid above that. The Band-Aid usually can come off the next day or even the same day. The steri strip is there to give you a little prettier scar. Within a week, it's not really doing much. It starts to curl up, absorbs the soap, and loses its adhesiveness. So you can peel those off within a week or 2 at the outset if they're really stuck well. Generally speaking, you'll have a mild narcotic pain medicine and potentially a non-steroidal anti-inflammatory like ibuprofen. So I will often give 600 milligrams of ibuprofen, and then some narcotic. It might be tramadol, might be hydrocodone. It depends on multiple characteristics, but generally you have those 2 medicines that work together. While you're on your narcotic pain medicine, you shouldn't be driving because you're intoxicated and you want to be healing up. Oftentimes I'll do these surgeries on Friday and usually take it easy by the weekend. Monday you can usually do most of what you want to do. It depends on what is done in the surgery. Minor surgery like getting the sterilization is much easier to recover from a bigger one with a lot of adhesions or a lot of a big tumor or cyst in your ovary where you need a bigger incision to get that removed. So there is a variation, and you'll be told that. But generally speaking, anywhere from a few days to a week is your recovery time, with most of the time 1 to 2 weeks and back into full function. You still have stitches there. You don't want to, even if you feel great, you want to lift heavy things and pop your stitch, even though not much would happen. It would give you a less pretty scar healing, but you want to avoid the really excessive heavy lifting, and that usually is until you have your post-op visit, which is usually around 4 weeks for me, but that might vary. We might see you 2 weeks or something like that afterwards. And for all surgeries, you want to watch, make sure you're eating okay, drinking okay, go to the bathroom okay, that you don't have any fevers. Infections from surgery, thankfully, don't happen too often, but they usually happen on the 2nd or 3rd day. We try to reduce your risk of a urinary tract infection, but that's something that might happen, so you want to be on alert for that. Also, one of the really important things that's crucial that I emphasize with my surgeries is one of the risk factors that really increase your chance of problems is smoking. So if you're a smoker, I'm sure you've heard this from me, that magnifies your risks of blood clots, of infections, of poor healing. And so even if you can't quit, it makes a tremendous amount of difference for you to avoid the smoking completely, not cut down from 20 to 10. Sure, that helps, but you really won't get the benefit unless you're at 0. You can do anything for a couple of weeks. That would really be quite helpful. Also, make sure if you're a diabetic that you keep good control of your sugar. You might end up needing to watch your diet more closely, and also maybe the Inflammation that you get from the surgery itself could increase your sugar level, so you might have to titrate that down, so increase your medicine. That would be something you would need to observe and watch for, but talk to your doctor who's prescribed your medicines if that gets a little bit worse. You also want to do some activity. Laying around after surgery increases your risk of blood clots, especially if you have other risk factors like smoking, like being overweight, like not moving, like having cancer, like being a lot older. Those are some of the risk factors. But a little bit of activity, walking around is good, even the day of the surgery or the next day, especially when you're not on pain medicines that can make you feel drowsy. So these are some of the general guidelines that apply to most surgeries that are laparoscopy for a gynecologist. Try to watch as you eat. We encourage you to drink fluids and eat healthy. Be careful about eating gassy foods that can add to your discomfort, like beans or broccoli, foods that can create some extra bloating. As you know, when you do a laparoscopy, we put some air in there. It's really CO2, and then we take that out, but there is a little bit that can stay in after the surgery, and that air pocket, the CO2 pocket, can irritate your diaphragm, and the nerve that goes to the diaphragm also goes to your shoulder, and so that gives you some shoulder pain. So it's not unusual to have shoulder pain, often on the right side, but it can be on both sides after laparoscopy. Doesn't mean anything was done to your shoulders, but it can be quite uncomfortable the first day or so. That's part of what your pain medicines are there for. And contrary to proper belief, taking a Gas-X pill or something like that doesn't help with that, because the gas isn't in your stomach, it's actually around your intestines in your abdominal cavity. But it usually subsides. But if you're wondering what happened to your shoulder, that's one of the quirks of a laparoscopy surgery. But thankfully it goes away in a day or so. So I hope you found this information of use. Please leave your comments. Thank you.